In this video, I'm going to cover cholinergic antagonists. So let's get right into it. Cholinergic antagonists can be divided into three groups. First, anti-muscarinic agents. Second, ganglionic blockers. Third, neuromuscular blockers. So let's start with anti-muscarinic agents, also known as anticholinergic drugs. These agents block primarily muscarinic receptors, thus causing inhibition of muscarinic functions. One of the most well-known medications that belongs to this group is atropine. Atropine's primary sites of actions are the following: eye, GI tract, heart, salivary, sweat, and lacrimal glands. Now, anti-muscarinic activity of atropine in the eye results in relaxation of ciliary muscle, which causes dilation of the pupil, also known as mydriasis, inability to focus visually, also known as cycloplegia, and unresponsiveness to light. So, ophthalmic preparations of atropine are used before an eye exam or eye surgery, as well as to treat certain inflammatory conditions of the eye. However, because of its long duration of action, other anti-muscarinic agents such as cyclopentolate and tropicamide are preferred over atropine. While cyclopentolate and tropicamide can produce mydriasis that lasts for hours, atropine's effects can last for days. Another feature of atropine is that it blocks M3 receptors in GI tract, which results in reduction of GI motility from stomach to colon. This translates into prolonged gastric emptying and lengthened intestinal transit time. At higher doses, atropine can also effectively block M2 receptors on the SA node and AV node, which produces tachycardia. Heart rate may increase by as much as 30 to 40 beats per minute. Lastly, by blocking muscarinic receptors on salivary, sweat, and lacrimal glands, atropine produces dry mouth, dry skin, and ultimately causes body temperature to rise. The next very well-known medication in the anti-muscarinic group is scopolamine. So scopolamine, unlike atropine, has a much greater effect on the CNS, as well as longer duration of action. For that reason, scopolamine is one of the most effective medications used for prevention of motion sickness and post-operative nausea and vomiting. It is available in a patch formulation that provides effects lasting up to 3 days. Another medications in the anti-muscarinic group that I want to talk about are ipratropium and tiotropium. Ipratropium and tiotropium block muscarinic acetylcholine receptors without specificity for subtypes. This results in decreased contractility of smooth muscle in the lungs, which in turn leads to bronchodilation and reduction of mucus secretion. Tiotropium and ipratropium are administered by inhalation for maintenance treatment of bronchospasms in patients with COPD. Ipratropium also comes in a nasal spray formulation, which is often used for treatment of rhinorrhea, which is runny nose. The main difference between ipratropium and tiotropium is their duration of action. Tiotropium is a long-acting agent that is dosed once daily, while ipratropium is a short-acting agent that typically requires up to 4 times daily dosing. Another medications that belong to this group are used for treatment of overreactive bladder. These include tolterodine, darphenecin, solifenacin, oxybutynin, trospium, and fesoterodine. These agents have varying selectivity for the M3 receptor, which is the main receptor involved in bladder function. However, the overall efficacy among all of these is very similar. Last but not least, I wanted to briefly mention two muscarinic blockers, benztropine and trihexyphenidyl, which through their ability to suppress central cholinergic activity were found to be very beneficial in treatment of Parkinson-like disorders. Now, before we move on to the next group, I wanted to make sure everyone watching this video remembers their ABCDs, which will help us to remember anticholinergic adverse effects, where A stands for agitation, B stands for blurred vision, C stands for